Good morning. As always, we'd like to thank Jay Gates for being here today to translate for those that are hearing impaired in our community. Thank you, Jay. As always, we're going to start with the numbers. Today, we have 411 people who have tested positive for COVID-19 in Hamilton County. 74 of those individuals are hospitalized, and we have 12 deaths. I'm going to start providing you with the delta between the previous numbers that we reported, which would have been on Monday, and today's numbers, so that people can get an understanding of the trajectory of this curve that we are on, the upward slope. So the delta for those that test positive is 92. The delta for those hospitalized is 13, and the delta for those who have died is 5. Upward slope, as you can see. It's clear that we are climbing the curve and things are exponentially getting worse. This is to be expected, and this is what has been predicted by our healthcare professionals. It is time to rededicate ourselves to fighting the virus and flattening the curve. Today, I'm going to ask you to set a new goal. Pledge to go out in public only when necessary, not to battle boredom. And I know this is difficult. We are all in the same boat here. So what we are asking is that if you have to make a trip to the grocery store or a trip to Home Depot, try to consolidate those trips. So instead of going out 3 times a week, where you are exposing yourself and others, you go out once a week. Safely distance yourself. That would be very helpful. We've heard stories, and we've got some comments coming later that have talked about how, and I know stores are taking precautions to try to keep a lot of people out of the stores, but really, it would go a long way if we individually would commit ourselves to not going out to these facilities on a frequent basis. That would go a long way to helping the cause. So we are at a critical time, but things are still under our control. So we have a lot of control over how this goes in the near and long-term future. Again, a reminder to wash your hands, don't touch your face, and safe distancing is important. We're going to talk a lot about masks here in a minute because we've got Greg Kesterman, the health commissioner here. I want to remind people that as you don your mask, remember that your eyes are still exposed. And so I don't want people to think that they are absolutely safe and have a barrier by wearing that mask. It's helpful. It's particularly helpful to people around you that are, within the 6 feet maybe as you're passing by people in a store perhaps. But you're still exposed because your eyes are exposed. Keep your hands off of your eyes. So I don't want people to get a false sense of security, even though I think it's a good idea to wear the mask. It's not the end-all, be-all. So again, ask yourself before you go out, is it worth the risk to yourself and to others around you? So before we get to Greg, as you can see, I'm wearing blue today. I'm wearing it intentionally because we've been asked to wear blue by our friends over in Child Protective Services because it's Child Abuse Prevention Month, and this is the day where people have been asked to wear blue. I know it's terrible to think about, but kids are especially at risk right now. What we know during difficult economic times is that cases of abuse go up on all fronts, but particularly when it comes to kids. And kids are not at school right now, and so the number of cases being reported for abuse and neglect have declined, but the expectation is that some of the abuse and neglect has gone up. And so if anyone in the community sees a kid that you think is at risk, please call 241-KIDS. They are operating that line, but we are in this really difficult time where abuse may be going up and reporting may be going down. So please be aware, please be cognizant. We're just trying to draw attention to this dynamic in our community. 241-KIDS is the hotline to call. So today, we've got Greg Kesterman here. we're going a little rogue today, because what we know is that folks out in the community have questions. We're getting them in our office, we're getting them via phone calls, we're getting them via email, and so we want to do things a little bit differently today to address some of the questions, not only from the press, because this is a press briefing, but also some of the questions that are coming to us via social media. And so we put out a request on Monday, it was a video, that said, hey, if any of you have questions that you would like, particularly the health commissioner to answer, and myself, send us the questions, and we'll do our best to answer those questions. So we're going to get to that today. It's a little bit different than what we've done in the past, but I think it's important. So before we get to the Q&A, I'm going to bring up Greg Kesterman, again, the Commissioner of Health. He's the guy. He's the expert in the field. It is by way of his guidance that we are doing so much of the work we're doing in Hamilton County. And so with no further ado, Greg, please come over.
Thank you, Commissioner. I will start this morning going over state numbers and showing a little bit more with Hamilton County numbers, and I have a couple graphics that we'll use to show there. The first graphic shows state of Ohio information, and in the state of Ohio, we have 4,782 positive cases of COVID-19. We also have 1,354 hospitalizations, with 417 of those being in the intensive care unit. There are 167 deaths statewide. You can see on the graphic that the curve is decreasing, and we are not seeing quite as steep of a climb, and Director Acting keeps reiterating many of the steps that we took 3 weeks ago, including closing schools, and some of those things are having an impact. The next graphic is Hamilton County cases. We just heard Commissioner Dreihaus run through those. You can see the cases as well. Once again, the things that we are doing here in Hamilton County will have an impact, and we are seeing that impact. We're still seeing spikes of cases, and we're still seeing things increase, but it's our hard work here in Hamilton County that is making a difference. The third and final graphic that I'll show is a zip code map that we rolled out last Wednesday. This graphic is displayed on our website, hcph.org. And I would encourage, if you're interested in what's going on in your community near you, to visit our website and to see that graphic. So that will get updated today. At the request of Commissioner Dreihaus and Mayor Cranley, our office is working to get that to display, including the city of Cincinnati, Norwood, and Springdale. I hope that will be done by 2 o'clock today. If not, we will update it one more time this week to make sure that it's as accurate as possible. So moving into a little bit of what we're hearing and what we're seeing, our office is still managing complaints that we receive, and we're getting a variety of complaints about certain businesses being open. My team is continuously working tirelessly to handle these phone calls and to manage each complaint that we get. Both the original order from the Director of Health and the amended order do have some clauses for essential business, and oftentimes businesses who don't want to shut work really hard to figure out ways that they can fall into that. Under Commissioner Dreihaus's leadership, in the second order, we do now have a dispute board. So when two health departments are handling a complaint differently, we are able to work with the dispute board so that we can see consistency across the state. That is something we've been saying now for several weeks would be very beneficial. The more we in Hamilton County treat a business the same as Claremont County or Cleveland, the better off we will be statewide for our activity. Another type of complaint that I continue to get a lot of feedback from the public on are these outdoor box stores, so the large stores that sell mulch as well as construction material. I want to reiterate, mulching the yard is not essential business. There is no need for you to mulch the yard right now. We are all in this together. However, construction is essential business, so my office will not be able to close these types of stores. They will remain open and they can still sell mulch, but that does not mean you have to go there. Each trip you make increases the risk for yourself and your family and your friends. So we are really just reiterating the point that Commissioner Dreihaus made. Make yourself stay home. This isn't the time to go entertain yourself. I know it's pretty, and I know if you have mulching to do, now is the time that you want to do it, but take that extra step and safeguard your family. We are getting ready to celebrate Easter across the community, and I've had a lot of questions about church. Church is exempt in the governor and the Director of Health stay-at-home order, so it can continue, but it doesn't mean you should go to church right now. Many services have been canceled. Many ministers have come up with alternative ways to celebrate, including church from the parking lot, including televised masses and services. I would really encourage, if you feel the strong urge to participate, to do so via the television or find a drive-up service so that you are protecting yourself. Many communities have had questions about Easter egg hunts, and even though they feel like there are ways that they can space kids out, Easter egg hunts should be canceled at this time. And I know these are difficult choices for our communities to make, and I know these are difficult choices, and these are just not normal times. So I challenge everyone to really think about what they can do to social distance. I wanted to spend a minute. I've also gotten a lot of questions about face masks, and I wanted to share a few different types of face masks. The first one is the N95 mask that we've heard so much about. I have two different types of N95 masks. This one fits close to the face, and it has the elastic that holds it onto the face. This one is called a duckbill N95 mask, and it kind of wears over your mouth and provides a little protection. When a medical provider wears one of these N95 masks, they actually pick the kind that fits best to their face, and there's a test they do to make sure that they are providing appropriate seal. If that seal isn't existing on your face, then you have the wrong mask and it's not providing protection. These are also the kinds of masks that we are asking the general public to not try and purchase. We want to save these for the medical community, and the only time the medical community is wearing these are when they're doing a procedure that would cause the patient to have droplets come out of their face, and that will help reduce the spread. We also have these surgical masks. These provide a basic level of protection, and these are similar to what we're seeing being worn in the public. They will help droplet spread. So if I had one on and I coughed or sneezed, it would stay within the mask, so I'm not spreading it out to the community. Similarly, if somebody coughed or sneezed near you, it keeps the droplets from making it into your body. As Commissioner Dreihaus said, it's really important still to keep your fingers off of your eyes, and when you're taking on and off the mask a lot, it will allow for some opportunity to touch your face and to spread germs. The last kind, one of my coworkers, Allison Barbaro, her family made this mask. These are the homemade masks. This one's very fancy and works really well, but they also have just some more basic ones. The Surgeon General, if you were to Google his name, he is making a mask on TV, and it's just with a handkerchief. So it's really easy to make and something you can do yourself. I want to reiterate, masks are helpful when you're in crowds, but if you're sitting in the driveway just catching some sun, you don't need to have your mask on. If you're driving in the car by yourself, you don't have to have your mask on. It's when you're in areas where social distancing doesn't work as well. So I think those are the only comments I had. Did you have anything you wanted me to reiterate further?
I don't think so.
Okay.
Right. Thank you, Greg. All right, so I think we're going to mix up the reporter questions and the questions that we have gotten from folks via Facebook. So I'm going to do a Facebook one first. We have a question. With all the great work that has been done expanding bed capacity in both hospitals and non-traditional settings, examples being convention center, how will they be staffed when existing beds are filled to capacity and the staffing is maxed out? Thank you for the question. The response is coming from the Health Collaborative. They are the experts in the field here. Remember, we had Krista Heisen here the other day. So we asked her, and here is the response. Alternative care sites like Duke Convention Center will be staffed with regional support. Folks like out-of-work school nurses, utilizing hospital staff that normally perform elective procedures, and the medical reserve corps that are all options that could help increase our regional staffing needs. Possibly even the National Guard could step in. That is still undetermined. More importantly, this question illustrates exactly why we must abide by the governor's stay-at-home order in order to protect our healthcare workforce. We can increase our bed capacity But if we do not have the nurses, doctors, and staff to take care of us, we will be in a dire situation. So the idea being the fewer people we have that need medical treatment, the better off we will be. And the capacity then is, would be appropriate to the number of folks we get in. So, Bridget, let's go to a press question.
Yes, our first question is from Scott Wortman with the Inquirer, and he has questions for Greg Kesterman.
Great.
Morning, Greg. One of the things that's come up in Kentucky and elsewhere in the country are outbreaks in nursing homes. That's obviously an at-risk population. What issues with nursing home cases have you seen in Hamilton County? Like, how numerous are they, and have you had particular issues with outbreaks at specific nursing homes?
Every single case in a nursing home is treated extremely seriously, and when we have a case in a nursing home, we work quickly with the state of Ohio, and actually a team called a strike team is developed where we have folks from the State Department of Health as well as from the nursing home portion of the state, and our team and nursing home representatives to make sure, A, that they have enough supplies to manage any kind of cases that they have, B, that they've got the appropriate procedures in place to ensure that their residents aren't leaving their rooms and aren't spreading the disease. And then the third portion is when their team are interacting with these cases, we don't want them to spread case from room to room to room. So there's procedures with masking up employees within nursing homes as well. It is definitely a challenge, no different than we've been seeing playing out at the state level with the jails. When we have one case in a group setting, it's very easy for COVID-19 to spread.
How many nursing home cases have you had? And are there particular nursing homes that you can highlight that have had a problem? Kentucky released figures on like each nursing home. Do you have anything like that?
I will have to consult with the State Department of Health to see what we're allowed to release in Hamilton County, and I will look into that and get back with you. Okay.
One of the other things I wanted to kind of clarify, as these cases ramp up, obviously, and we've spoken on this before, this is taxing your guys' resources. As you get hundreds of cases, you have to do contact tracing, enforce quarantines. How much longer is it taking to do that with the staff that you have?
So we are very efficient, and the very first week when we first saw a ramp up beyond one or two cases, we did see a ton of staff time devoted to it, and then we kind of set some procedures, and I think I shared previously that about 1/3 of our entire agency staff are providing some capacity to our epidemiologists and disease investigators. The state also, statewide, I shared just a little bit ago, has a whole bunch of cases. So statewide there's 4,700 cases, and so the state is also aware and has taken steps throughout the outbreak to adjust the needs and the workload for health departments. So very early on, health departments across Ohio, with each with each pending case, before we knew they were positive, we would do contact tracing. About 3 weeks ago, they shifted that, and now we are only doing contact tracing when we get a positive case, and public health is not notified when there's a pending result. Just yesterday, actually, the state, for each contact of a positive case, we would call that individual for the next 14 days and take temperatures. And just yesterday, the state has changed that guidance, and we are only going to interact with them initially, letting them know they're a close contact, and then we'll interact with them if their symptoms change. So the state is working to make sure that we are able to appropriately address the pandemic, and as well address the pandemic in a way that's appropriate for the amount of community spread. We know it's in the community, so the steps we're taking now are to further mitigate, and the focus has been on social distancing now because we know it's in the community.
So going forward, what lessons can be learned on where either the state or local municipalities will need to invest in local public health to be prepared for the next crisis?
You know, I think after this is done, we will find some areas that we could have done better. I know when we first ramped up, it kind of caught us a little bit by surprise, and we adjusted immediately and were able to have the appropriate response. But what that did was made our team kind of tired up front. Things like that, I think we'll figure out in the future, ways to better address when we start to have an outbreak like this. But overall, Scott, I have been so proud of my team. We have come together and managed cases that an agency hasn't had to manage ever. And our team has done so, and we're calling people back the same day, and we're handling both cases and complaints, and really great work from my team and others in the county.
Thank you.
Question comes from Facebook. Barbara Doble has several questions. We will answer some of them in the Facebook chat offline, but here's her first question. If a person has a letter from their doctor recommending that they not treat COVID patients, in fact, they should not be at work for the next 30 days, can their employer refuse them unemployment? This is from a person working as a physical therapist in a nursing home.
So I have a response to this per our staff. Unemployment eligibility is determined by the state's Department of Job and Family Services. We can't offer advice on individual situations, but if you have questions about unemployment, you can call the state. I'm going to say this number slow. It's at 1-877-644-6562, or visit unemployment.ohio.gov. Thank you, Bridget.
Our next question is from Jay Hanselman with WVXU for Greg Kesterman.
Hi, Greg. Following up, this came up in Governor Beshear's press conference earlier this week. What message would you send to families who say, look, we always get together for Easter weekend, we have a small family, what can it hurt to gather for Easter like we always do?
These are very difficult times, and I would really encourage you to not gather in the same way that we have in previous years. You know, family connections are super important, and if you feel that as a family you must make that meeting happen or that Easter celebration happen, consider doing so outside and social distancing between different family groups. The truth is, not everyone that has COVID-19 shows symptoms, so if one family is positive with COVID-19, it is still possible to spread it to another family. And if we're ignoring those social distancing requirements, then ultimately we are making others sick. And it could be a very bad outcome, and we have seen that happen.
And just one other thing, we've talked a lot about being on the curve and climbing the curve. What metric do you look at to say we reached the peak? Is it all the indicators, new cases, hospitalizations, deaths, or is it just new cases?
It is all of those together, and we're actually relying very heavily on the Ohio Department of Health, who has a team of statisticians that are working with the Ohio State University to develop that curve. So we're learning more each day. Never in a pandemic have we had the ability to have this much data, and so the models that the Department of Health and others have put together are very accurate.
Thank you.
Commissioner Kesterman, another question for you from Facebook. Are we still seeing overdoses during this COVID-19 pandemic?
Yes, we are, and our office still reports daily on the number of overdoses, and I think it's important to remind everyone that just before COVID-19 demanded the headlines, we were in the middle of a battle of another sort, and that's fighting the disease of addiction. We have an entire community that is battling this addiction problem and is also fearful of COVID-19. Our office remains available for Narcan distribution, and as a matter of fact, we are working on a plan to send it out when we receive requests. You'll be able to get that information on our website, hcph.org. As always, we also are making Narcan available through our harm reduction program. So once again, hcph.org for more details.
Another question for you, Greg, from John London, News 5.
Can I interject for 1 second?
Sure.
So we, HCARC, which is the Addiction Response Coalition here in Hamilton County, has been talking through some of these issues related to addiction in the epidemic that continues in this community. So we've been talking about bringing them in for a briefing, both on the law enforcement side and the prevention and treatment side, to kind of round out that conversation, because what we, I think, saw was a decline in the supply chain for the fentanyl and carfentanil. And so I think we're going to expound upon that a little bit in one of our briefings next week. So more to come on that, but thank you, Greg, for reminding us that we still have many people in this community suffering from addiction, and resources are still available. They may look different than they have in the past, but they're still available. And also one other thing, when we talk about Easter and the importance of people celebrating the holiday, I do want to remind people that Passover and Ramadan are two other holidays that are drawing near, and so we don't mean to talk about just one holiday. And anecdotally, my family, there are many of us, get together on Easter. We have a big Easter egg hunt in my mom's yard. We all hide eggs and all that stuff. Clearly, we're not doing that this year, and I haven't talked to my siblings about this, but I'm about to design a chart where we can go sit on the back porch. Don't enter the house. Don't touch any doorknobs. We go around the back of the house. We have chairs set up already that are over 6 feet apart, and we can take shifts and visit my mom. We are not going to be getting together. I mean, we can't do that. And so we've made so much progress to this point. I think it would be a mistake to ignore it even on one day so that we can celebrate a holiday. It's just not worth it. And our elderly, no offense, Mom, our seniors are especially at risk. We just can't put them in peril like that. So anyway, I just wanted to provide an anecdotal response to that question. Is the next one for Greg?
It's actually, I could do it for you.
Okay.
John London from News 5. I'm going to read his question for you, Commissioner. With more information out there now regarding the impact of coronavirus on the African American community, what can be done and what should be done by the county to reach African American neighborhoods with information that could save lives and further limit the spread locally?
Thank you for this question. I think we're learning more about this as the days go. And so Greg and I are going to be on the Lincoln Ware Show today, actually, in about an hour and a half, to make sure that everybody in Hamilton County is hearing the message about safe distancing, about hand washing, about not touching your face. I do think there are some gaps in communication. We need to understand how people get information and get their news. And so Lincoln Show is a way to try to fill in part of a gap, and so we're doing that today. I'm grateful for those of us that have reached out, or those that have reached out and said, you know, we need to do more of that, so we're doing it. But I do think we're going to see some discrepancies here, and we're going to start to dig into why we even have those discrepancies in Hamilton County. To be clear, though, we are not tracking, and I'll let Greg expound on this. The state is tracking by race. The county at this moment in time are not tracking by race. But Greg, will we have the capacity to do that?
That is our goal.
Okay, so we are going to have the capacity to do that. I asked Greg to start to look at that a few days ago, and so we hope to get there relatively soon.
A follow-up question for Greg from John London from News 5. He writes, much has been said about the CDC's recommendation to wear a mask in public to protect others in case you unknowingly could spread the virus. But many folks want to know what specifically they can wear to protect themselves from getting the virus. Does the health department have a suggestion?
The first suggestion is don't go out into the public unless you have to. So stay home. This is a stay-at-home order that we're working through right here. So I think the very most important thing is if you don't have to and you're not an essential worker, stay home. Secondly, those cloth masks that we are starting to ask people to make and wear at home, or start to make them at home and to wear, they are providing minimal protection for yourself, and we are asking that that's probably the best thing at this time. Those masks, if somebody coughs and there's droplets, they will keep the droplets off of your nose and mouth. Ultimately, as Commissioner Dreihaus reiterated earlier, your eyes are still unprotected. So if somebody coughs and droplets get on your eye, there is continuous risk for individuals. So that's why the message is stay home when possible, and then social distance when not possible. Give that 6 feet of distance or create barriers in between yourselves. We've seen a lot of our grocery stores create social distance for their employees and creating glass between the employee and the customer. These types of things will provide protection out there.
Thank you, Greg. Another follow-up question for you from Facebook. Kelly Thompson, Cranford, just wondering, if someone has tested positive for COVID-19 and then has quarantined for 14 days, are they safe to resume normal life?
Excellent question. If you test positive, the health department where you reside has been in contact with you and will be in contact with you before you're allowed to go back to the community. The general rule of thumb is when you have COVID-19, you're not to go back to work or be in public until 7 days from the onset of symptoms and 3 days from the day your symptoms stop showing themselves. So if you had a fever, 3 days after that fever subsides, it's okay to go back in public as long as it's been a full week from the time that you first got sick.
Thank you. A follow-up question for Commissioner Dreihaus, and this comes from Chris Wederick with the Cincinnati Business Courier.
Hi, Denise. Can you give us an update on the amount of money that you believe the federal government is going to provide the county? And is there any plans or thoughts on sharing any of that money with cities, municipalities, villages, and townships?
I didn't catch all of it, but I think I got the gist of it. So you're talking about the dollars that are coming from the federal government. We are still trying to track down, first of all, how much. I know I said a figure last week. That is what we understand at this moment in time, but there is a very wide range of our understanding of what we might get. That's first. Second of all, we're trying to get an understanding of how we can spend those dollars. And so what we think we know is that we can spend them on things that are related to the outbreak of COVID-19 in this community. So what does that mean? I mean, all of what we're doing right now is related to our response to COVID-19. So we're trying to get an understanding of whether or not that can be utilized for personnel. I am not optimistic, by the way, about that outcome. What we think we know is that obviously we can use it to buy PPE. I was asked this question earlier about the action we are taking tomorrow related to the homeless population. Those dollars, remember, are CDBG dollars, and some of them will be reimbursed through this money. We're confident that that will qualify, but we're still trying to track that down. And so more to come on that. We're working through it. But thank you for the question. As you might imagine, I'm doggedly pursuing this because we need to know how much and we need to know what it can be spent on.
Commissioner, this one for you from Facebook. Sherry Hadley writes, my driver's license needs to be renewed the first week of May and my tag on my car. Where do I go to renew?
All right, thank you for this question. So we have contacted Charlie Norman. He's the director of the Ohio BMV, and I'm going to read his answer. Between our driver exam stations and the deputy registrar agencies, over 1 million customers a month appear in person at our offices. With this in mind, the state closed all BMV locations due to COVID-19. With the passage of House Bill 197, which was recently signed by Governor DeWine, all driver's licenses, ID cards, temporary tags, and vehicle registrations were extended throughout the duration of the declared emergency, plus 90 days. Customers can, however, continue to renew their vehicle registration both by mail and online using BMV online services at O-Plates. Okay, so that's weird. OPLATES.com. Your registration stickers will be sent to you in the mail. Although registrations are extended by the emergency legislation, we strongly encourage customers to renew online or by mail at their normal renewal time, as longer wait times are expected when the physical offices reopen.
Thank you, Commissioner. I have a couple questions for Greg, and this comes from Facebook. It's Kelly Thompson Cranford. I'm just wondering if someone has tested positive for, next question from Barbara Doble. I have an extra CPAP machine which has been used. Is there use for them in this battle? And if so, what's the contact information to donate them?
Thanks for the question, and I love how many people have reached out with things that they might be able to donate. I really appreciate it. A CPAP, or a continuous positive airway machine, is a tool for sleep apnea, and at this time I have confirmed with our medical director that they are not helpful for this pandemic at this time, but I do greatly appreciate your willingness to provide that.
A follow-up question, where can I donate opened N95 masks?
Feel free to drop those masks off at our office. We have a bin in our front vestibule. Our office is found in Clifton at 250 William Howard Taft Road.
And a follow-up question from Facebook. This comes from Sally Huffman-Derrick. Why are some contractors not given stay-at-home, seeing so many of them on sites?
That's an excellent question, and at this time, under the Ohio Director's Order, construction of all kinds is a essential business, and so contractors and folks working on roads and things of that nature are allowed to continue.
Another question from Facebook. Dennis Brown writes, how many COVID-19 tests have been conducted in Hamilton County?
We do not have an estimate for the number of tests conducted. And the reason is there are so many private providers and private hospital systems that are doing testing outside of the Ohio Department of Health's lab that we can't get an accurate count on that.
From Peggy Rolfson, are there any documented cases of people who have been isolating themselves still getting infected from inanimate objects like food deliveries, for example?
We have no cases that have self-isolated that we are aware of that have contracted COVID-19.
Thank you. For another one for you, Greg, from John London from News 5. Can one safely scratch or touch one's face as long as it's not the eyes, nose, or mouth?
The best bet anytime you're going to put your hands near your face, you need to wash your hands, and that will protect yourself. The truth is, though, we are all so used to scratching our faces and touching our faces because it's just human nature. So right now is the time to focus on not touching your face at all unless you wash your hands first.
Will Vincent on Facebook asks, why do we not see the numbers of people sick with the flu anymore? Why don't we shut down like this for H1N1?
So the significance of COVID-19, the death rate is much higher than it was for H1N1. When H1N1 first reared its ugly head in 2009, there actually in the United States was a vaccine, and public health was instrumental in getting that vaccine out to the younger age group. H1N1 had the biggest impact on our children. School-age children were the ones getting sick and the ones dying. COVID-19 is different. We are seeing death rates for those that are older much higher than the flu or even H1N1.
Thank you, Commissioner. Another question for you from Nikki Allen. Do you think this will be over by the time pools open?
We cannot wait for COVID-19 to be finished. I know the director's order has canceled public pools opening at this point until until Director Acton feels that it's safe to do so. So public pools are not set to open as they normally would just yet. As soon as we can get them open, we will.
And this is from Kevin Leindecker. Greg, restaurants are under extreme conditions. Turnover is high. We need free and more frequent level 1 and level 2 training.
So our level 1 and level 2 training, because it is a classroom style training, it is not available right now because we don't want people in our office. There are on our website tons of fantastic fact sheets to help your team out. In addition, there are some trainings online that are rather inexpensive for level 1 training. You can take a level 1 class online for under $20. Feel free to use one of our contact forms on our website, hcph.org. And if you would like that information sent to you, feel free to request it through our website.
All right, one more for you. This one comes from Linda Broadsbank. Once we test positive and recover, are we then immune to COVID-19?
So there is a lot of science out on this still. We do not have an exact answer, and so I can't answer it definitively at this time. Many diseases, if you get the exact same strain, we do see people not get the same disease. But as we know with the common cold, you can get colds a couple times throughout the winter, and that's because there are different strains. So a lot of research happening in this area, and as soon as we know more, we'll share.
Thank you. We got a question from Twitter. SHW2012 asks, possible for every household to get a test? Question mark. How do we know if we have COVID, cold, flu, cough season, and mild symptoms? I guess could be mild COVID too.
So at this point in time, the guidance hasn't shifted. We're still trying to get folks who are sick with symptoms tested. We are seeing increased testing capacity across the state, and at some point we might do some more sentinel testing, or where we look at a greater population of folks not showing symptoms. It is really important to note, though, if you're non-symptomatic and you think you might have COVID-19 and you're worried about it, the test won't help you. The test only shows if you have symptoms and are shedding the virus. That's when we can find out if you're positive for COVID-19.
Thank you, Commissioner. That appears to conclude our questions from Facebook and from reporters.
All right, thank you. Thank you, Bridget, for doing that. And thank you all for your questions. It's really helpful for us to know what's on your mind, because if it's on your mind, my guess is it's on other people's minds as well. So it gives us an opportunity to address some of the concerns and questions out in the community that we may not otherwise be hearing. So thanks so much to Greg Kesterman. As I said, we are going to be on Lincoln Ware's show a little bit later this morning. Also, Commissioner Parks is going on Lincoln's show. Her brother had COVID-19. And so she's got a personal story to tell, and I know she's going to be talking about that. So to the question earlier from John London, we are trying to do our best to make sure everybody in Hamilton County has the information they need to keep safe during this crisis. So as you know, we're going to be back on Friday. We're going to be shifting gears a little bit and talking about small businesses and how small businesses in our community can successfully apply for an SBA loan. We're also going to have a business that has applied for an SBA loan, and that business owner is going to kind of talk us through the process, what it looked like, what the time frames were, to help others that are in a similar situation. We'll be talking more next week about small business kind of outside the SBA program. We've got Jill Meyer from the Chamber and Eric Kearney from the African American Chamber coming in to talk a little bit more about small businesses. And as I said, we're looking about having something related to addiction also part of the conversation next week. So again, thank you for joining us today, and we'll be back on Friday.
Call the cops on your phone, bro. I'm on the phone with the cops.